So today, me and my colleagues are going to talk to you all about either our first clinical experience or our most memorable one. Hopefully you enjoy it and learn something from it. My most memorable clinical experience was actually last semester on the very first day. It was a new hospital I've never been in before. I was with my nurse. We had it was a night shift. We had a pretty good night so far. And next thing you know, I hear code blue, code blue. I looked to my nurse and I said, hey, do you think we can go over there? And he said, well, no, I still have patients I need to take care of. I said, okay, well, how about, can I go over there and just watch and come back after, and I can come back right back and help. And he said, okay, but just stay out the way. So I'm over there and I'm watching, and it's crazy seeing these people work together as a team. It's kind of like a race car driver's tires getting changed. Like that's the best way I can describe it. I'm watching them and the nurse asked me, she says, do you work on this floor? I said, no, I'm a student. She said, well, do you want to hop in on compressions? Me? You want me to hop in on compressions? My legs got weak. I was nervous. I said, yes, I do. They helped me scrub in, and I was doing compressions, and I tried my best, and I rotated out with some other nurses and PCTs. Unfortunately, she didn't make it, and it was sad. And it took me a little bit to actually come to grips with the fact that she's not here anymore. It wasn't even my patient, but I cared a lot. And that helped me become a better student, and it's gonna help me be a better nurse, because unfortunately, the reality is that you have other patients you have to take care of. Me personally, I'm religious. I prayed over the situation, and I had to move on. That was my most memorable clinical experience.
Hi, my name is Destiny Jones, and today I'm going to be talking about my craziest clinical experience. This was about my third week into clinicals, and I walked in and my first patient had altered mental status. For this case, they actually had patient monitoring in the room, which was my first time ever seeing like this little robot camera, basically keeping an eye on the patient. Throughout the day, after we did our rounds with the nurse, we would go in and out passing medications, on hour or after lunch, things like that. And as we were in this patient's room, the nurse was typing up her medications because clearly the patient wasn't doing well at giving consent since her mental state was altered. I noticed that the patient was seizing. And so I turned to the nurse and I was like, ma'am, I think this patient is having a seizure. And she was like, and I was like, no, I think she's having a seizure. And I'm not 100% accurate, but in this case, I definitely noticed like something was wrong. Nurse turns around, she looks at her, and she sees what I see, and she gets out her pen light. She's checking her eyes, making sure that her mental status is there. She's checking around, looking at her arms, legs, making sure it wasn't a stroke, because it could have been, hand in hand. So in this case, we leave the room. 3 hours later, we get a call from the little robot eye, basically saying that they witnessed her having a seizure as well. I would just say that was a crazy day for me, because you just have to trust your gut and just go with what you think you see, and what you think you know is probably correct.
Hi, my name is Ellie. I'm at senior level 1, so I'm going to talk about my first time in the OR. First thing is the surgical tech took me down to the OR, and before entering the OR, we both had to put on a surgical cap. We go out to the pre-op, post-op area. We meet the nurse there. She goes over consent, gets the consent from the patient. We go to the OR, and before entering the OR, we put on a bunny suit. It's a suit that covers the entire body, and it's to keep from contamination. We enter the OR, and before the procedure begins, they do a surgical timeout. So all the health professionals in there, they just check to make sure it's the correct patient, correct site, and correct procedure. And then the procedure begins. First time in the OR, it was my first time, seeing a procedure, a surgery, so it was really exciting.
Hi, my name is Savannah J, and I'm a senior level 1, and I'm going to be talking about my first clinical experience. I was in the PACU, which is the post-anesthesia care unit, and this is where your patients are coming off of anesthesia. Sometimes they're confused or agitated, and that was the case with my patient. He really wanted water, which we're not able to give those patients in the PACU because they might choke, and the water might get into their lungs. So we offered the mouth swabs, and he was not too happy about that. He asked me if I wanted anything bad to happen to me, and of course I said no. And then he proceeded to reach across the bed he was in and punch me in the face. School protocol, I had to go to the hospital's ER and get x-rays and make sure that nothing was broken. but I was fine, didn't have any bruises or anything. This just goes to show that you never know what to expect with clinicals. You always want to go with an open mind, but hopefully you don't get punched on your first day.
Hey, I'm Porfirio. My clinical experience, I have cared for patients from diverse populations from different cultures and backgrounds. I had to care for a patient. This patient was an inmate, and something you don't want to do is look up what they did. Only because it shouldn't affect the way you care for them or treat them. Everybody should be treated and cared for the same way. When I was in there was 2 guards in there. There was nothing to worry about. I gave the best care that could have been given to the patient. Hopefully the patient was okay after that.